All right, you're gonna test for hip impingement, and then I'm gonna briefly go over what's going on. So a quick test for hip impingement is you're gonna bring your knee up as high as you can, and then you're gonna internally rotate it as far as you can, or get that foot outside the knee, and then you're gonna grab onto that knee and pull it towards your opposite shoulder or across your body. Now, if you get any pinching in here, there's a good chance that you have some type of impingement going on. And by impingement, I'm just gonna show you with this model. So if you see here, we got the acetabulum or the pelvis, and then we've got the femur and the ball and socket of the hip joint. Now, if I go into here, you'll notice that there's two little red dots here. Now, this is meant to be a neutral position for that hip bone. Now, if I were to rotate the femur in, you'll see those red dots start to come closer together. And if I anterior tilt or tilt that pelvis forward, you'll notice that the red dots line up or come in contact with each other. And this is what's happening during an impingement. In these positions and if these spots are in contact for prolonged periods of time, this is going to lead to a lot of problems down the road. So in a rehab setting, we want to make sure that we're working on externally rotating that hip or getting that hip away from that site of impingement and working you into a posterior pelvic tilt so that we're not continuously flaring up that impingement, and we can get out of pain and move better.